teams, Lauren here with Bizrok. This week's video, it's probably going to be pretty short, but I want to have this conversation because I've had this conversation a lot for whatever reason over the last couple weeks, and that is making sure that we're collecting and being proactive on the phone with our patients. We spend so many times talking about new patients and how to overcome objections on the phone, and so sometimes the recall patients get a little forgotten about. So today's video, this week's video is just on recall patients and making sure that we're being proactive. So when one of our established patients calls the office to maybe they're scheduling or moving or they're double checking something about their appointment, make sure that we have the process of, hey, Susie patient, while I have you on the phone, just to confirm, last time you had Blue Cross Blue Shield insurance, is that still the same company or has your plan changed? Also, home address. Susie patient, real quick, last question while I have you on the phone. Last time you were at 123 ABC Lane. Is that still your home address? So making sure that we're being proactive, we're being curious, we're trying to say, let's get ahead of this. If their insurance has changed, if their address has changed, if you're missing information, it's also a great opportunity to check out their email information. Do we have an email address for the patient or do we need to update it? And then finally, and I know your doctors are going to really love this one, we should be proactive about treatment. So even if Susie patient calls and she says, hey, I just need to schedule a quick cleaning visit with you guys, I'm overdue, great. Get that patient scheduled, build rapport, create commonalities and likability, but then look at the rest of Susie's family. Does her spouse, does her children, are they overdue too? What about treatment? Is there any outstanding treatment? Just, hey, Susie, while I have you on the phone, it looks like your two children are also coming up on their next cleanings and we don't have them scheduled. We are booking out about 6 weeks right now, so let's go ahead and get them back on doc's books, okay? Being proactive, having those conversations ahead of time over the phone, but also whenever they walk in. So yes, if you're doing it over the phone, you shouldn't have to do it right when the patient arrives, but it's just one more layer of making sure that we're being proactive and we're ensuring that everybody is following the same process. So when that recall, that established patient walks into the practice, we welcome them as we always do. I know you guys do an amazing job at that, and then just still go through the same things. Susie patient, real quick, it looks like you previously had Blue Cross Blue Shield insurance. Is that still your insurance company? Great, check that off our list. Also, you were at 123 ABC Lane. Is that still correct? Beautiful. Let me just check before the hygienist takes you back. I know she's going to be up here shortly. It looks like your children are coming up on their next dental visit and they don't have anything scheduled. While we have a couple minutes, let's go ahead and get them scheduled, okay? So I want you guys to kind of be ahead, and I know some of you are doing such an amazing job. I've had this conversation over the last couple weeks, so I figured, what better way to cover this topic, but also a friendly reminder to make sure that we're all following the same process is to put it in a weekly video. So over the phone or in person, we want to get insurance information, address, emails, outstanding treatment. So I would encourage you to put this in your process, make sure it's a best practice for your practice, and then ensure that everybody is following that exact same process. So as always, we are here to help and serve you in any way. If you guys have questions or if you're like, Lauren, how do I put this in my best practice? Reach out to us. We love hearing from you. So we can't wait to see you and serve you soon. Have a good one.